again, we do sick care. So it turns out, well, first of all, I'm diabetic. You may not know it if you were to see me in person. I'm a pretty skinny guy.
Hmm.
Yeah,
Type 1 or type 2?
a weird type 2. So
Really?
first of all, that's another thing. Diabetes is not just type 1 and type 2. It's probably more like type 1 through type 50. Uh,
Wow.
so type 2, we know we can subtype. For example, some people don't make insulin well. Other people don't release insulin from the pancreas. That's me,
Hmm.
actually. Most people, their cells don't respond to insulin.
I see.
Um, Insulin lets your cells take up glucose. That's the most common form of diabetes, but there are many subtypes.
Yeah. So hold on. I just want to make sure I understand because I actually I didn't know that there was that much difference there. So type 2, broadly speaking, that means you have acquired insulin resistance and become diabetic late in life, as opposed to being getting it early in life because your pancreatic beta cells got destroyed. So
Correct. So
most,
that's type 1, by the way.
yeah,
What
that's type 1.
describe type
Type
1.
2, most commonly, people are producing insulin, but their cells are no longer responding to insulin as much. But you
Right.
have a different version.
That's correct. In fact, and it's not unheard of either. It's not common. So my version is that I do make insulin, my cells respond, but I don't release insulin from the pancreas.
Hmm.
And not only that, it turns out I don't respond to metformin, which is also kind of unusual.
And that would be a common drug that people do respond to.
Yep, and that's what most people do, and it works pretty well for most type 2 diabetics, and it's generally viewed as quite safe. These days, there's a whole bunch of other drugs out there you may know. These Ozempic derivatives, they mimic a hormone called incretin, and they're extremely effective. So anyway, I didn't respond to the most common drug. It's metformin, but I did respond to something that stimulates insulin release from the pancreas. It's called rapinolide.
Hmm.
And I actually worked well with that. Now, these days, I'm on actually one of these GLPs because they work even better for me. But yeah, so these Ozempic kinds of drugs. I
Yeah.
happen to be on one called Manjaro.
Yeah.
Anyway, they work incredibly well on me. But we think this is really important because diabetes has many subtypes, and the way you treat people very much depends on the subtype you are. That
Right.
is like I was just describing. I respond to certain drugs, but not others.